Hi, I'm Dr. Shelly Flais. It may surprise you how common developmental disabilities are. About 1 in 6 children have a developmental disability, such as cerebral palsy, ADHD, or autism. If we identify children with developmental disabilities early, they're more likely to have the best possible outcomes. That's because interventions work best when given to young children when the brain is rapidly developing. Unfortunately, at least half of children do not benefit from early intervention because they are not identified until after they enter school. The American Academy of Pediatrics recommends a combination of both developmental surveillance and developmental screening. This combination is best to promote healthy development, prevent delays, and identify children with delays and disabilities as early as possible. Surveillance is flexible and ongoing and is something a healthcare provider should do at each visit. Surveillance includes asking parents about their concerns, taking a developmental history, observing the child, identifying strengths and risks, documenting results, and communicating with other providers. Developmental screening, on the other hand, involves using a standardized screening test, also called a screener, at specific ages recommended by the AAP, and whenever concerns are raised by the parent or pediatric provider. Screening rates have increased, which we are all glad to see. But keep in mind that it's the combination of surveillance and screening that improves early identification. They each have certain strengths which build on each other. For example, a pediatrician doing surveillance during a well-child visit may find a child is developing typically at age 6 months. But she may also detect certain risk factors such as a parent who is depressed or who is not talking much with the child. In this case, by doing surveillance, the pediatrician picked up on some opportunities to intervene early to promote the child's healthy development. On the other hand, screening can detect problems not identified by surveillance alone. For example, a child with cognitive delays may not be recognized by a parent or in a typical office visit. So we should strive for high rates of screening, and we should also aim to conduct developmental surveillance at all health supervision visits. Currently, only 1/3 of parents report being asked by their child's doctor if they had any concerns about their child's learning, development, or behavior, a key component of developmental surveillance. In this video, I'll cover some strategies to incorporate routine developmental surveillance into your practice. The first 2 parts of surveillance are eliciting parents' concerns and obtaining a developmental history. Typically, these are done simultaneously by a healthcare provider using a strengths-based approach. Before asking about concerns, the provider might ask, what new things is the child able to do? What is he good at? And what new milestones has he reached? Look for resources you can share with families about developmental milestones and incorporate them into your practice and practice flow. This way, families will understand that you are interested in their child's development and that you value parents' perspectives. This will also help families recognize their child's milestones and communicate their concerns about how their child is learning, developing, and behaving. Good resources include the Bright Futures pre-visit questionnaires and CDC's Learn the Signs, Act Early, free resources and milestone tracker app. These provide developmental milestones you can review with families. While taking a developmental history and eliciting concerns, it's also a great opportunity to encourage families to read, talk, and sing with their child to foster healthy development. A third part of surveillance is making accurate and informed observations about the child. Healthcare providers are trained to observe how a child is regulating, interacting, communicating, and moving. These observations, along with a physical exam, can reveal developmental concerns. A fourth part of surveillance is identifying risks, strengths, and protective factors. The longitudinal relationship you develop with families gives you the opportunity to get to know their protective and risk factors. It is important to ask families about their family support, childcare, local community and religious supports, and any significant medical history such as prematurity or congenital heart disease, along with any adverse childhood events such as food insecurity, housing problems, or mental health issues. A fifth part of surveillance is documenting and maintaining a record of outcomes of surveillance and any next steps. You should have a system to longitudinally document and review a child's development with any concerns, risks, strengths, or protective factors. You should also document that developmental surveillance results were discussed with the family. If there are concerns, you should administer a developmental screener and take appropriate steps. If the concerns are significant, the child can be referred directly for early intervention and further evaluation. The sixth and last part of developmental surveillance is sharing and obtaining opinions and findings with other professionals. Good communication between the medical home and other care providers is essential to ensure optimal child development. It is important to work within your community and systems of care to determine how best to communicate opinions and findings. You may want to contact early child educators, WIC, home visitors, and early intervention programs to obtain their perspectives, including developmental screening results performed through their organizations. Developmental surveillance is rewarding. It improves family satisfaction and engagement. Like screening, it is an important way that we can promote healthy development, prevent delays, and identify children who need intervention as early as possible, all to give children the best chance of reaching their full potential.